Hey everyone, it's Dr. Hodges, and I am just sitting here waiting for one of my videos that I made while operating upload to a little thumb drive. And I thought I'd make a quick video talking about kind of medicine versus surgery. Now, I'm sure some people out there might say, you're a surgeon. Of course, you're going to like surgery more. And yes, there is a little truth to that. But I had to pause it just for a second. The little zip drive thing didn't want to go. Um, However, we definitely have distinct research out there that frankly is compares medicine to surgical weight loss. So let's kind of go over some of the facts that are out there. Did you know that when you look at the success rate, or maybe I should say the recidivism rate for a medical weight loss program, and that means if you're doing diet plus exercise, recidivism means you've lost weight and now you've regained it. You know what the risk for that is? It's hovering right around 96 to 98%. So when they were following patients kind of over like a 5-year period, usually they were able to keep the weight off for up to 24 months, and then it was slowly creeping back on. And a lot of us, I find, we can lose the weight. The tricky part is keeping it off. And isn't that what we want? We don't want to keep on doing this endless cycle. Well, when you look at the success rate of surgery, the success rate, not the recidivism rate, the success rate is greater than 85%. So, success rate for long-term weight loss with just straightforward diet and exercise, 2%. Compare that to about 85 to 86% with surgery. I mean, it's kind of a no-brainer. So I think that there's a lot of misinformation out there about surgery. It's not uncommon for me to get a lot of, my cousin's best friend's dad, their hairdresser said, and I'm like, oh my gosh. Surgery's safe. It's actually safer for me to do weight loss surgery than for me to take out your gallbladder. And that's one of the most widely performed surgeries in the United States. Oftentimes, patients, they're either in the hospital overnight, or sometimes you're even able to go home the same day with these surgeries. They're laparoscopic. You can typically get back to work within a week or two. But I think more importantly, it's not just getting the weight off, which clearly the vast majority of patients, when they're coming to me, they want to get the weight off. But it's not always, I'm finding, just simply they want to get the weight off. You know what they really want? They want to be able to qualify for that orthopedic surgery. They're like, Doc, I got to get this weight off because I got to get my hip done, or I got to get my knees done. And the reality is that an orthopedic surgeon does not want to operate on you when your BMI is over 30. And if they're doing a total knee on you, not only do they want your BMI lower so you can have a good, healthy, safe surgery with them, they want to make sure that that knee or hip or whatever that lower extremity joint that they're putting in, that the life cycle doesn't wear out too soon if you begin to regain that weight back. It always breaks my heart when I have a patient that comes to see me and maybe their BMI is 45 or they're 50 and they're like, I think I just need to lose 30, maybe 40 pounds. And I'm like, oh, honey, you probably need to lose, 70 to 80 or even more just to get you into a healthy BMI. So my goal is always, let me get you to a BMI less than 30. Let's just have that as a basic goal. And I know that there is a lot of chatter out there about BMI, and BMI is just a ratio of your weight to your height. And some people, when they talk about BMI, they talk about, well, if you have a lot of muscle mass, that can be skewed. And that's absolutely right. One of the ladies that works in my office, her son is a bodybuilder. Guess what? He's going to have a skewed BMI. But for the vast majority of the population, you don't look like Arnold Schwarzenegger. You know what I mean? That's not where your weight's coming from. And so if you are like the average American, then BMI is actually a pretty good guesstimate of where your weight is, because what we're trying to do is kind of standardize weights across the board. And many of our studies, I mean, I would venture to guess most of our studies in bariatrics, BMI is always a metric that we follow. And so they're in thousands of papers. And so that's how we've been able to kind of stratify, meaning group different individuals in terms of outcomes, resolution of health problems, things like that. So please don't look at BMI like it's this evil number. It's just we're trying to get you to a certain point where we're really decreasing your health risks. So, if you are on the fence about surgery, do some research, seek out a good surgeon. If you're in DFW, call me. But, you can always try medicine. However, oftentimes I almost feel like it's a fool's errand for some of my patients, especially when they're coming to see me and their BMI is over 35, certainly if it's over 40, because I think in the long run, they're just going to become incredibly frustrated. They might be able to lose the weight up front, maybe 30, 40, possibly even 50 pounds. But my concern for them is that if they're not adding in that separate component, if they're not having surgery, they're just not going to have the longevity that they need. And so those health problems are just going to worsen. I mean, the reality is that surgery is the only thing that's been found to put your diabetes into remission. So you have diabetes, get surgery. It's going to go into remission. Nobody wants to take that metformin, and certainly you don't want to take insulin. So it's just some food for thought. In the end, in my practice, I really just want to help you lose weight. But there's a lot of misinformation. There's also some fear, and I totally understand that. Most everybody on their weight loss journey, the very first thing that they're thinking is not, I'm going to go get surgery. But the reality is that if you are looking for something that is going to give you the best outcome, the best long-term results, surgery is going to be what it is. Okay? So anyway, hope that this helped.